Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and rare case that has emerged in veterinary medicine: vertebral angiomatosis in a dog. This is based on a report in the Journal of the American Animal Hospital Association. While this condition has been recognized in cats, this marks the first documented case in a canine patient. This condition should be considered a possible cause of insidious thoracolumbar myelopathy and/or back pain in young dogs. Our story begins with a 3-year-old spayed female Cavalier King Charles spaniel, a breed known for its charm and affectionate nature. However, this particular dog presented with an insidious onset of ataxia, or incoordination, and paraparesis, a weakness of the hind limbs. For 8 long months, this dog had been showing signs of pain and a reluctance to jump, a clear indication that something was amiss. The initial approach involved steroidal and non-steroidal anti-inflammatory drugs, which provided only mild, temporary relief. Unfortunately, the clinical signs progressed, and 3 months prior to presentation, the dog's gait became noticeably abnormal in the hind limbs. A thorough physical examination revealed that, aside from the neurological issues, the dog appeared normal. However, a detailed neurological examination exposed marked proprioceptive ataxia in the pelvic limbs, meaning the dog had a reduced awareness of its body position. Paraparesis was also evident. Postural reactions were diminished in the left pelvic limb and absent in the right, further confirming the presence of a neurological issue. Spinal reflexes, however, remained normal. Adding to the diagnostic puzzle, palpation of the thoracic vertebrae elicited a pain response. Based on these clinical findings, the veterinary team localized the lesion to the thoracolumbar region, specifically between the third thoracic vertebra, T3, and the third lumbar vertebra, L3. The list of potential causes included degenerative, congenital, inflammatory/infectious, and neoplastic etiologies. To further investigate, the veterinary team performed a complete blood cell count and serum biochemical analysis, but the results came back within normal limits. However, thoracic radiographs unveiled a radiolucent lesion affecting the vertebral body and pedicle of the fifth thoracic vertebra, T5. This finding prompted further imaging using computed tomography, or CT, and magnetic resonance imaging, or MRI. Under general anesthesia, a CT scan was performed using a 16-slice CT scanner, followed by an MRI of the thoracolumbar, vertebral column, and spinal cord using a 0.17 T magnet. The MRI sequences included T1 weighted T1W, T2 weighted T2W, and short tau inversion recovery, STIR, images in both transverse and sagittal planes. T1W images were also acquired after intravenous administration of a paramagnetic contrast agent, gadovercetamide. The CT scan revealed focal osteolysis, or bone destruction, of the vertebral body and pedicles of T5. Moreover, a hyperdense, extradural material was observed within the vertebral canal, causing moderate spinal cord compression on the right side. This material exhibited moderate heterogeneous contrast enhancement. The MRI confirmed the presence of an extradural lesion at the level of T5, which appeared hyperintense on T1W, T2W, and STIR images, with mild and irregular enhancement after contrast administration. The lesion was compressing the spinal cord on the right side. The MRI also revealed an abnormal morphology of the T5 vertebra and a mild hyperintense signal on T2W images within the spinal cord cranial to the mass, indicative of spinal cord edema. Given the severity of the spinal cord compression, surgery was recommended to decompress the spinal cord and obtain biopsy samples for histological examination. Initially, the owners declined this option, but 6 months later, the dog's condition had deteriorated to paraplegia, and they elected to proceed with surgical decompression. A T4, T5 hemidorsal laminectomy was performed on the right side. During the procedure, a proliferative tissue was observed, causing ventrolateral displacement of the spinal cord. The abnormal tissue was carefully removed and submitted for histopathological examination, along with bone fragments from the body of T5. Macroscopically, the biopsied tissue appeared yellowish, firm, and measured 0.2 centimeters in diameter. Histopathological analysis revealed an encapsulated, moderately cellular vascular proliferation infiltrating the bone trabeculae and soft tissue. This proliferation consisted of a mixture of arterial and venous blood vessels admixed with small capillaries and collagenous stroma. The endothelial cells lining the blood vessels were arranged in a single layer and exhibited indistinct margins, central oval nuclei, or paracentral nuclei, with compact chromatin and inconspicuous nucleoli. Anisocytosis and anisokaryosis, variations in cell and nuclear size, respectively, were mild, and mitoses, or cell divisions, were rare. The bone tissue appeared widely fragmented, necrotic, and multifocally remodeled. Immunohistochemistry confirmed the vascular origin of the lesion, with the capillaries showing strong positive staining for cluster of differentiation 31 antibody and factor VIII. The cells surrounding the capillaries were negative for neuron-specific enolase. Based on these findings, a diagnosis of vertebral angiomatosis was made. Postoperative analgesia was provided with methadone for the first 3 days, followed by antibiotic medication, cephalexin, for 5 days. The dog was discharged 4 days after surgery with tramadol, omeprazole, and firocoxib. Initially, the dog was paraplegic but showed improvement over the following 2 weeks, eventually becoming only mildly ataxic. Unfortunately, 5 months after surgery, the dog's neurological status deteriorated, revealing non-ambulatory paraparesis. A follow-up CT scan revealed a recurrence of the intracanal lesion. Given the recurrence and the dog's declining condition, the owner declined a second surgery and elected euthanasia. Vertebral angiomatosis is a rare vascular malformation characterized by a proliferation of blood vessels with well-differentiated walls. Distinguishing it from other proliferative vascular disorders and neoplastic lesions can be challenging due to overlapping morphological features. The pathogenesis of vertebral angiomatosis remains incompletely understood, but is considered a non-neoplastic disorder. In human medicine, vertebral angiomatosis is often referred to as hemangioma, with an estimated incidence of 10 to 12% in the general population. However, only a small fraction of these cases, around 1%, exhibit aggressive behavior and become symptomatic. The most common initial symptom is back pain, followed by chronic and progressive thoracic signs of myelopathy. In veterinary medicine, vertebral angiomatosis has been reported in cats, but this case marks the first documented occurrence in a dog. The clinical presentation in this dog shared similarities with feline cases, including insidious and progressive signs of pain and difficulty walking due to a thoracic lesion. Neurological signs in human patients can arise from bony compression caused by hypertrophy of the cortex, vertebral body, laminae, or articular facet joints, as well as from soft tissue extension of vertebral hemangioma into the epidural space. The latter reflects an aggressive behavior, as observed in the presented case. Diagnosing vertebral angiomatosis can be challenging, as radiographic features may mimic neoplastic diseases such as plasmacytoma, osteosarcoma, or metastatic disease. Radiographic studies alone cannot differentiate between these conditions and only aid in localizing the pathological site. In human medicine, vertebral hemangiomas are radiographically classified as typical, atypical, and aggressive. The typical and atypical forms are defined by MRI features influenced by the amount of adipose and vascular components and interstitial edema of the hemangioma. Aggressive forms involve the vertebral body and arch, characterized by small, highly attenuated areas representing thickened hyperdense trabeculae surrounded by hypodense stroma, creating a polka-dot or honeycomb appearance on CT. MRI typically shows increased signal intensity on both T1W and T2W images with a hypointense area and variable post-contrast enhancement. The imaging features observed in this canine case were similar to those reported in humans. The definitive diagnosis of vertebral angiomatosis relies on histological examination. Immunohistochemistry is crucial to confirm the vascular origin of the lesion and rule out other rare vertebral neoplasms with vascular components, such as hemangioblastoma. Hemangiosarcoma is excluded based on the absence of significant atypia of endothelial cells, low mitotic count, and the overall microscopic architecture of the lesion. Various treatment options exist in human medicine, including surgery, vertebroplasty, direct ethanol injection, radiotherapy, embolization of feeding arteries, and combinations thereof. However, a consensus on the optimal treatment strategy for symptomatic cases remains elusive. Surgery is typically indicated in cases of rapid clinical deterioration or progressive neurological symptoms. Radiotherapy is employed for patients with mild and slow progressive neurological deficits and to reduce recurrence after subtotal tumor resection. In veterinary medicine, surgical treatment has been reported in cats with vertebral angiomatosis, with generally favorable outcomes. One cat that underwent surgery and adjuvant radiation therapy showed no evidence of recurrence 26 months after the initial diagnosis. In the presented canine case, the dog initially recovered well after surgery, but relapsed a few months later. In human medicine, postoperative irradiation is often used after incomplete or subtotal surgical decompression to reduce the risk of relapse. While one cat in the veterinary literature experienced a prolonged recurrence-free period with surgical decompression and radiation therapy, there is currently insufficient data to recommend radiotherapy as an additional treatment in dogs and cats. In conclusion, vertebral angiomatosis is a rare condition in both dogs and cats, with similar clinical and histopathologic features observed in both species. This condition should be considered as a possible cause of insidious thoracolumbar myelopathy and/or back pain in young dogs. MRI findings alone cannot definitively distinguish vertebral angiomatosis from other neoplasms, and surgical treatment may lead to rapid improvement, but incomplete resection can result in recurrence of clinical signs. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.